Hello, this is Dr. Stephen Wexler. I'm the medical director here at WashU Med LASIK Surgery Center. I want to talk today a little bit about PRK. The first thing I think you need to understand about PRK is that the reason we do it is for safety. When we look at LASIK and PRK, odds of having a complication or the risks are about the same. But in certain individuals, PRK is the safer option. If that's the case for you, that's what we're going to recommend. The other thing you have to realize with PRK is that outcomes are exactly the same as with LASIK. Now, of course, if you compare a week out, everyone prefers the LASIK eye because you see better, so much quicker. But if you really compare outcomes 3 to 6 months down the road, PRK and LASIK outcomes are identical. Your odds of achieving 20/20 are the same. So don't feel like it's a lesser procedure. It's not. It's really every bit as good a procedure. And to me, if it's safer, better to go with safer. A couple of things to realize with PRK is that it's actually easier to go through the procedure in the laser suite than LASIK. Why? Because we don't have to make flaps. And making of the flaps sometimes can cause a little pressure, can hurt a little bit, but we're actually doing that procedure for about 30 seconds. PRK, in contrast, is much easier. There's no pressure from the suction ring. It's basically just looking at a green flashing light, and it takes less time also. In the actual laser suite, PRK is not painful at all. You're laying on your back, you're looking at a green flashing light. You can sort of feel me touch you, but your eye is numb. You can't feel anything on your eye. When we're all done, which takes about 9 minutes to do both eyes, we'll put on a soft bandage lens and let you walk out the door. Immediately you'll notice your vision is a bunch better. And you're comfortable that day almost always. In fact, when people come in on day one, they say, I don't know what all the fuss is about because it really is not uncomfortable at all. As that top layer grows back on day 2, day 3, that's when you can have a day where it hurts a little more. Now, usually it's not severely painful. It usually burns, tears, feels like there's something in the eye, nose runs. Very often helped with oral Advil, very often helped with a little ice pack on the eye, and the drops we give you called Ketorolac, they help a whole bunch. So day 2, day 3 is sort of the worst day, but it's not severe. By day 3, day 4, day 5, you're pretty much done with the discomfort. Vision starting to get better as each day goes by. We're going to take out that bandage lens usually on day 5. And every day after that, that vision gets better and better and better. We do PRK in about 10 to 15% of all our patients. And we do it for safety reasons. I want to make sure you understand, PRK is not a lesser procedure. It really works every bit as well as LASIK. It's different in that it has slightly different risks. It takes longer for vision to recover. But if all we had in this world was PRK, it would still be a miraculous procedure. A 9-minute procedure that corrects your nearsightedness, and within a couple of weeks you're driving a car without glasses, that's miraculous. But I just want to emphasize that PRK is still an excellent procedure.